depending on where you are in the world. Good evening, good afternoon, good morning. I don't know, but anyways, um, so as you can tell, I have I have good news to share. Um, Miss Jasmine had her surgery this morning, and it went well. Like when she came out of surgery, and they got her all situated and whatnot. She acted like it never happened. Like she was just like, okay, just awake, looking around, like la 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 la, you know. So I just wanted to let everybody know that her surgery went well. She is recovering beautifully. These next 2 days will be a little gotta be a little cautious these next 2 days. However, Jasmine is tough. She's doing great, and it's a matter of time before she comes home. Um, they said that in the next after a couple of days they'll start weaning her off the oxygen little by little, because they want to give her time for her lungs to dry up, and then I guess she won't even need oxygen support anymore. So that's fucking awesome. Yay, I'm so excited. um just the next step is just trying to do feeding therapy or having a G tube surgically done, or me learning how to administer the NG2, which is kind of scary to me, but I don't know. I could do whatever. I mean, it's a matter of just being taught. I'm not, incapable of learning stuff. So, but French, yeah, I'm capable of learning that. But anyways, other than that, I'm good to go. So, they said that you get to pass a course anyway, so they're gonna really make sure I know what I'm doing before they take her home. They're gonna make sure I'm doing it right. Like it's actually a fucking course I have to take, and I have to do it so many times without assistance before they're like, yeah, you got it. So, yeah, I'm pretty confident that I'm gonna be okay with learning that. It's just, and when you think about it, it's like, that's something a nurse does, not a mom. That's not a nurse, but I guess I'll be all right. Figure it out. So she's doing great, and hopefully the next video I share with you guys is her at home in my arms, or maybe me holding her at the hospital, without the tube because it is helping her breathe, and they have to keep it there, until her lungs dry up. You know what I mean? So once that happens, they'll take the tube out, and she'll be all right. Um, so when that happens, you know, I will do a video with my little Pookie and show you how she's doing. I want to talk to all the parents out there who have children diagnosed with trisomy 18, 21, 13, 20. Basically, to all the parents out there who were told that their child was given a death sentence before they even were born. I want you to listen and listen up, okay? I don't know what the hell I'm doing right now. I'll be straight up because I've never had to be in this situation before. But as I'm learning, one thing I can tell you and relay to you from experience, you know, a lot of these doctors don't know what the fuck they're doing straight up. They know basics and statistics, but they really don't know the ins and out. And I feel like my daughter was cheated because, as a doctor, as a person who's supposed to be held to a higher standard of learning, you should want to learn about a certain case, especially if it's your patient, to how to to better help them, because there is information out there. There are doctors who have experience with babies with certain illnesses. So I think it's important as a medical professional to not just rely on what you know already, but you have room to grow. And they honestly, they don't do it. It's so fucked up, but they don't take the time to learn from other doctors who have been there. And it's so messed up because they give up so easily, and they don't have to. I had to rely on other parents to, learn what to do for Jasmine. And like I said, any parent out there whose child was given a death sentence before they were born, it is not the end. And don't listen to that, okay? I urge you and I beg you to dig and talk to other parents. if they have a child or had a child or have a child with their diagnosis. You're better off listening to them. They've been through it. They know what they're talking about. And now as I'm learning and learning from other parents, I'm going to relay that information to you guys because this fucking sucks. And nobody should ever be told that their baby is not worth loving. Like that is so messed up. And that's basically what they told me, that she would not be worth giving birth to. And you know what? Guess what? I love that little girl with all my heart, and I know it's gonna be a challenge, but fuck it. I'm down. I love her. I don't give a fuck. I'm gonna do whatever it takes to look after my baby and love her the best way I can. And I want all the parents to know that you can still love your child. And yes, it sucks that they might not have them for as long as a child without a fatal diagnosis. But one thing that my doctor did tell me, my primary doctor, when she was my doctor, she told me that loving your child is never the wrong decision, and she reassured me that I made the right decision regardless. So, I'm telling you, you know, I can't personally say that everyone out there has my strength. We're all different, but I can honestly say, personally speaking, I would have regretted having an abortion. I would have regretted listening to them. I'm glad I didn't. I love her. And you're gonna love your kid, you're gonna love your child, and you're gonna love him or her. And even if it's not for a long time, that love still matters. It doesn't. The time on earth does not negate how much you love them. Okay, so love your children, and if you don't have a child with a fatal diagnosis, make sure you kiss and hug them each and every fucking day, every moment that you can, because this is not an easy. This is not an easy journey for any parent. In my situation, it fucking sucks. But the one thing I can hold on to is that I love that little girl and I'm gonna keep fighting and she's fighting and I owe it to her to keep doing right by her. And you owe it to your children to do the same, to not give up, okay? Do not give up on your babies, okay? Please. And if you need advice or I can direct you to some support groups via Facebook, please hit me up. Message me. I think my email is in my YouTube about section, whatever. There's some information there for you to contact me. So please, if you have questions or you need advice, whatever, I don't care. Hit me up. Um, your fight is my fight. I know what it's like. It sucks, but I'm here for you guys, okay? So be easy and take care, okay? Bye.